Following the conferences, and we've had three thus far, and this lecture is being recorded in March of 2024. So there have been three medical conferences that the FLCCC has sponsored, each focusing on COVID and COVID-related illness and expanding into other things like cancer and metabolic disorders. But this prompted me um, after the first conference to structure a COVID illness recovery center, of which I have set up one in Murrells Inlet, South Carolina, a few years ago, and here's the flyer for that. The FLCCC protocols or recommendations are updated frequently, so I'm not going to be presenting anything here now because it may be obsolete by the time this viewing you're viewing this recording. So basically, you set up with establishing some good history and physical examination. That's very prudent whether you do this in person or via telemedicine. Also, some basic labs like a CBC and a CMP. But we also are recommending the S-spike IgG antibody titers and quantitative. So you get a number. D-dimers, immunoglobulins, CD57s, and myeloperoxidase, as well as fibrinogen, are recommended, along with interleukin 6 and other inflammatory markers. PAI1 and some are also recommended to check for microclotting. The focus should be on other chronic illnesses, not to be ignored. You sometimes have to co-manage things like type 2 diabetes, obesity, chronic Lyme disease, mold toxicity or mold illness, and some environmental agents like heavy metals and the such to exact an improvement in your patients. So use of medications, we have ivermectin, nitroxoxide, hydroxychloroquine, colchicine, some use of montelukast and MLK, for example, prednisone, low-dose naltrexone, obviously, aspirin, Eliquis, amloxanox, rapamycin, methylene blue is becoming very popular, as well as things that cover tick-borne illness. The use of supplementation like resveratrol, zinc, selenium, vitamin D, vitamin C, spermidine, quercetin, and medicinal mushroom extracts, along with N-acetylcysteine to help promote biofilm disruption as well as glutathione production. Also, IV or a very good sublingual glutathione and peptides have broken onto the scene as to be very effective and helpful. Oxytocin, synapsin, curcumin, melatonin, and fulvonic acid and baobab are other agents that are being used successfully.